I'm going to share the story with you of two aha moments, both revolving around the life-saving toolkits that we at Saving Mothers distribute to pregnant women. It's a story that highlights both the shared experiences of giving birth, no matter where on earth you live, but also the wide discrepancies in available birth care. I'll start here at home in New York City, where Saving Mothers has been giving out Empower Kits, and I wish I brought one with me. These are maternal health kits that contain resources that women need to basically take charge of their maternal health care and understand their health risks in pregnancy. They also contain communication cards that are meant to help them talk to their doctors and nurses in the hospitals and clinics so that they can make sure that they are both seen and heard. Because we know that racial disparities in maternal health care is very high in New York City. So these kits are specifically aimed toward addressing racism and disparity, making sure women can advocate for themselves, get their needs met, and frame their questions in a way that they can get quick answers but that are also thorough. The kits have these resources including a blood pressure cuff, a Fitbit, Benadine stockings to address blood clots. These target the top causes of maternal death here in New York City, and that's where we focus the kit. These kits cost about $125 to make because they have a lot of resources that are nice resources, like the Fitbit and the beautiful diaper bag that they come in. But to the mothers, they are free of cost. They are nice kits that we put together and we do them by hand, like our teams pack them. The goal of the kit was to reduce maternal health, was to reduce maternal deaths, and to improve their odds in pregnancy. We give it out to the women and we ask for feedback. And one mom, I remember, said that, and this was definitely an aha moment. One mom said when she opened the kit and she looked at the resources, and when we asked her feedback, she said, when I opened this kit, I just started crying because no one has ever given me something so beautiful and so valuable. And I never thought that I deserved something so valuable. That was her feedback. And it was certainly an aha moment for me as a public health practitioner because I'm thinking that she's going to give us feedback about a blood pressure cuff or how she used the resources, but rather she was so touched that someone took the time to pack this kit for her and she just loved it so much. She said, I brought my Empower kit everywhere. I brought it to every appointment. I did everything that was in it. I felt so lucky to have such a resource. I thought that was really, really interesting and really telling about how mothers, especially underserved mothers, those who live in shelters or areas in the city where they don't have a lot of access, are truly in need of attention, of care. She could see that we put a lot of thought and effort into it. And so when we added to it from based on feedback from people with notes and affirmations saying that you can do this, we understand you, we hear you, the feedback was even better. So we added this mental health component to the kit. So now the kit has a journal, and the journal has inspirational words and stories for mothers along the lines of "You are valuable and important. You are amazing. You can complete this pregnancy." We have inspirational words to get them through pregnancy and as well as postpartum. That one helped us understand the mental health piece, which I think is something that needs more attention to it. But the most important part about these kits is that they're low cost and high impact. The Empower kits that we've used in New York, and then we have another kit, probably our longest standing kit that we've used at Saving Mothers since 2009. This is called our Safe Birth Kit, which we use in various parts of the world, including West Pokot, Kenya, where we provide free care to women, as well as Guatemala, as well as the Dominican Republic. The Clean Birth Kit or the Safe Birth Kit was meant for over 80% of women that deliver babies at home in most regions of the world. In most of the world, there aren't a lot of trained OBGYNs. There are whole countries that have a handful of trained doctors, and the vast majority of women around the world are being delivered by birth attendants or midwives with varying levels of training. Some places have some training and others not that much. And that's why we go to these places. That's why we offer these safe birth kits. That's why we also train the birth attendants. That way we can create cycles of care that empower women and that allow them to continue that work even further. Thank you.